Welcome to our presentation on Orem self-care theory. Throughout this presentation, we hope that you will be able to 1. Describe Orem self-care theory. 2. List at least 2 constructs related to Orem self-care theory. 3. Describe how Orem self-care theory was used in this study. 4. Identify supportive education as an essential component to the healthcare success of the patient, both in and out of the clinical setting as it relates to Orem self-care theory. And lastly, 5. Discuss how Orem self-care theory was used in the intervention to assess for self-care management of patient with myocardial infarction. Dorothea Orem was born in 1914 in Baltimore, Maryland. She was a nurse and an educator amongst other roles. She earned her doctorate degree in 1976. During her years of teaching, she realized that patients would go to the hospital and be treated and then would return home with no education about their condition. She sought to make a difference in the lives of others and therefore developed the theory of self-care. The self-care theory is divided into 3 categories: nursing systems, self-care deficit, and self-care. The theory of self-care is related to activities that an individual does on their own to maintain their health and well-being. This is usually a learned behavior. Examples of self-care activities include activities of daily living, adjusting to a new life change such as a new job, and care required for illnesses such as taking your daily medication. The theory of self-care deficit is the reason why nursing is needed. When patients are not able to care for themselves, healthcare workers, specifically nurses, take on this role of caring for the patient. Some methods of helping include guiding and supporting the patient, educating them, providing them an environment where they can personally develop, learn, and improve their condition. The theory of nursing systems describes how the patient's needs will be met, either by the patient, the nurse, or both. There are 3 classifications, which include wholly compensatory system, where the nurse takes full control; partly compensatory system involves both the patient and the nurse; and then supportive or educative system, where the nurse takes on the role of the teacher. The goal of the study was to assess the effect of a supportive educational intervention based on Orem self-care theory in regards to patients that had an MI. The participants were 66 randomly selected individuals with a diagnosis of MI, and they had also been recently discharged from a coronary care unit. Patients in the experimental group received education, support, and counseling, while patients in the control group received no intervention. The PCOT question identified from the study is, in patients with cardiovascular disease that lack knowledge about their disease, how effective is a supportive educational intervention compared to no intervention in increasing levels of self-care knowledge, motivation, and skills? When it comes to applying Orem self-care theory to the study, specifically with patients with MI, the importance is health maintenance and self-care abilities, so it's important to assess their self-care knowledge, motivation, and skills in order to determine how to intervene effectively. Patients in the experimental group were assessed via the 47-item myocardial infarction self-care ability questionnaire, where then they would be given proper education based on how they assessed. The first intervention was a pre-test to assess the patient's ability to care for themselves on what type of education the patient may need pertaining to MI self-care. The second intervention was the education. They were divided into different educational classes depending on their pre-quiz grades. And then the third intervention was a follow-up call to assess how they were doing and if they needed further education. The fourth intervention was to administer a post-test to assess the client's ability to care for themselves. When it comes to the implication for nursing practice, the implementation of supportive self-care education in the clinical setting is beneficial not only to the patients but also to the healthcare workers and even the hospital facility. As an outcome of this study, the education provided to the patients in the experimental group had an overall positive impact on the betterment of their knowledge, motivation, and self-care ability surrounding their disease. Another important implication as to why we should provide patients with the essential self-care and knowledge is that it prevents further rehospitalizations and progressed illness. Because of these outcomes, there is a potential to save money for the hospital systems due to not having to eat the cost of a stay by a patient that does not have insurance. In addition, it's important to remember that it is the nurse's role to educate the patient on their condition, on how to manage their symptoms or risk factors to look for, or if they have any diet or exercise plans that need to be put into place. It's also good to remember that the education should be equally distributed in the patient's stay. They should be starting teaching from the beginning to the end of their stay. This would help with any questions that the patient might have. That concludes our presentation on Orem self-care theory. Thank you very much for listening.